Hello, my name is Karan Log and I'm a physician in Colorado. It is currently April 21st, 2020, which means that we are right in the middle of the coronavirus pandemic. Just this past weekend, there were numerous protests and demonstrations regarding repeal of the stay-at-home orders that are in place across the country. And what I wanted to do was I wanted to provide a little bit of the medical rationale and background regarding those recommendations. And just wanted to first acknowledge the tremendous economic impact that this is having on everybody across the world. And I can imagine even the personal impact, whether or not individuals had school, whether or not they had weddings planned, whether they had trips planned, and the impact that it is having on those individuals. But when I talk to patients about the coronavirus, what I tell them is to think of the coronavirus like a fire. Where, again, every time an individual gets infected, what we're doing is we're basically spreading that fire and allowing the fire to burn even longer and, brighter. So when we talk about, minimizing the economic impact, the fastest way to get the economy back is to really follow two extremes. One extreme is to just let everything burn and dump the fuel on all at once. And so if we were to literally ignore the coronavirus and just resume life as normal, where everyone goes back to work, schools are back in session, sports are back, concerts are back, everything is back to where it was, again, we would get the maximum number of individuals infected all at once in a very rapid period of time, but that would also result in the maximum number of casualties. Another way is to be more extreme in terms of isolation and allow nobody to contact anybody for the next 3 to 4 weeks. If we were to find a way to isolate everybody for the next 3 to 4 weeks, then the coronavirus will basically just burn itself out just like a fire. If you're not adding fuel to the fire will burn itself out. Again, those two extremes are the fastest way to get the economy back up and running. The unfortunate reality is we really don't want either of those two extremes, with one extreme being nearly impossible to do. Anything in between will unfortunately result in higher casualties compared to the full restrictive model, but also prolong the duration that the illness is with us. And so, when we look at the purpose of medicine, what are we really trying to accomplish from a medical perspective? And it always sounds horrible when I talk to patients about this, but ultimately in medicine, what we want to accomplish is nothing. We want nothing to happen. We don't want anyone to get a heart attack. We don't want anyone to develop cancer. We don't want anyone to die. And the way that we measure that is by nothing happening. Okay? And it always sounds really weird when I talk to patients about that, but we actually do this all the time. If you think about our national defense, our military is predicated on the idea that nothing happens. Again, we could literally make the argument that 9/11 happened, again, 20 years ago. So at the same time, there hasn't been a big terrorist threat. So do we basically look at decreasing funding to the military because there hasn't been a military or a major terrorist threat in the last 20 years? Again, the whole point of the military is to prevent things from happening. So we don't want multiple terrorist events happen throughout the country. Medicine is predicated on that same exact purpose, where the more nothing happens, the more successful we feel like our interventions are. And the good thing about the current interventions is they are getting to a point where nothing is happening, where we're hoping that this burns itself out, but we still get individuals who are being affected. And so, when we talk about prevention in medicine, there are different modes that we talk about. So the first prevention that most people think about is what we call primary prevention. So primary prevention means that these are interventions that are aimed at preventing the disease from occurring. And so smoking is a classic example where if an individual is smoking, medical professionals would recommend that individual stop to hopefully prevent them from developing lung cancer, COPD, or other diseases. But that is a primary prevention and intervention. When we talk about the coronavirus, that this is where hand washing, social distancing, masks in public are basically all aimed at preventing individuals from developing the disease. And so this is also where we look at the development of a vaccine, where if we could develop a vaccine, again, that would be a form of primary prevention, but the unfortunate reality is that we are not looking at a true vaccine being developed in the near future. The next is what we call secondary prevention. So secondary prevention is basically where someone develops the disease, but what we're preventing is them from getting very, very sick from the disease. So that's actually where mammograms and a lot of your cancer screenings come in. So where mammograms do not prevent individuals from developing the disease, but what they do is, again, the patient still may need surgery, radiation, chemotherapy, but what we're hoping to do is decrease the illness and cure them of their disease, and again, ultimately prevent them from dying from their breast cancer. So when we talk about secondary prevention for coronavirus, this is where testing comes in. And the whole idea behind testing is that it absolutely changes what we would do from a medical perspective. So if someone doesn't know they have the disease, it changes their behavior. Again, they still may go out, they may still talk to neighbors, they may still go out to get something to eat, even though it's takeaway. But if somebody knows they have the coronavirus, again, they should be quarantined, where they should have no contact with any individual for the next 7 to 14 days. And so, the other thing that this allows is that, once somebody gets a positive test, it also allows potential interventions. And so, right now the WHO is actually, putting out a trial called the Solidarity Trial, where they are looking at, interventions that have the potential to be effective according to other countries and other experiences among providers. And so, again, in each arm, they've got hydroxychloroquine with amoxicillin. They've got a drug used for Ebola. They've got another drug that was used for two-drug combination for HIV. And in the fourth arm, they've got the HIV drugs with interferon. And so this is where we would really be able to determine if there was really a better therapy for the coronavirus. And the difficulty is, what we have to remember is that, again, a majority of patients, again, we're looking at a 1 to 2% mortality potentially, where 98% of patients will do well without any interventions. And so what we're really looking at is how many patients, or what can we do to prevent patients from worsening and needing tertiary prevention. So tertiary prevention are interventions where a patient has developed the disease with severe symptoms, and we are ultimately preventing them from dying. And so, again, what we would look at if somebody developed a heart attack. Again, they've already developed a heart attack, so again, we may need to stent them, we may need to do bypass surgery on them. From a coronavirus standpoint, the tertiary prevention is the ventilator, where, again, their disease has become so severe that they need assistance with breathing and they need to be placed on a ventilator. And so, what you can see is that the purpose of these interventions is to really buy time. Time to develop a vaccine, time to develop good, effective therapies for this. And the sooner we're able to come up with better treatments, the sooner we can actually get back life to normal as much as possible. And so, what we have to do is, in order to get life back to normal, we need to invest in the science. We need to invest in the technology and the data to allow us to move forward and know how to treat this disease. Okay? What we also know is that primary prevention is better than secondary prevention, which is better than tertiary prevention. And so if you think about it, hospital workers are actually not the front line in fighting this disease. You are, the general public. And what we have to remember is that you are the primary prevention. Hospitals are the last line of defense. And the hospital is where this battle will be lost, not won. Only primary preventions and what individuals do in public are going to ultimately determine what happens with this disease. Okay? So again, I hope you found that helpful and informative. And if you have any questions, feel free to comment. And I wish everyone the best out there, and please be safe. Thank you very much.